Hello, this is Andrew Davey at Nevada Forward, and we're here with Margarita Romano, clinical social worker intern here at BBS Counseling in Las Vegas. Thanks for joining us.
Thank you. Thank you so much for the invitation and thank you for this opportunity.
So, first off, to let our readers know, for the past week, you've been providing mental health care services for people in need following the October 1st shooting. What's that been like?
Yeah, that's right. It has been all of our Las Vegas community. We were in shock since October 1st, which we see a lot of people in need, and we thought at the beginning that not a lot of people in the Hispanic community was going to be directly impacted by this unfortunately event, but we were knowledge about them. All the people that were cleaning, serving, providing food, selling food in the event are actually Latinos, and they needed immediate crisis assistance. Every time that a person goes through a traumatic event, the first thing, maybe they're not medically or physically injured, but psychologically they're very impacted. Some of them. We have kind of both. We have some people that has been also medically or physically injured. So first of all, we provide that resources for them to get the help. But now also the psychological part is gonna be quite a more long-term providing this assistance. The first thing that we have been doing is trying to give them stabilization, providing with like food resources, transportation resources, and other sorts of needs depending on based on each client.
Yeah, I guess that's the first common misperception that, even as national media attention starts to fade, this is still a big deal down here in Las Vegas. This is still an emergency for many people.
It is an emergency. It has been a moment of crisis directly for the victims and their families of the victims, but also indirectly for the rest of the community. This is something that we were not prepared as a city, something that as human beings, we're never prepared for these type of things. It's very a shock. A lot of people, maybe the first days that they were coming here to receive the mental health assistance, the first day maybe they were like, no, I'm okay. You can start talking with somebody else. We're fine. But then by the days were passing, people was more processing what really happened. And as we know, when we are in a stage of shock or trauma, the first thing is more like the denial. It's like, no, this is not happening, or this didn't happen to me, I'm okay. But as our levels of adrenaline comes down in our body, then we start feeling all the either the physical aches or the emotional pain.
And then that's another thing that you've been filling a critical need in providing counseling services, not just in English, but also in Spanish.
Yes, that's correct. Some people that has been guided or they've been referred to us, their primary language is Spanish. So that's what we're trying and what we're giving. When somebody is in a stage of very vulnerable, very emotional, they feel more comfortable to receive the help and the support in their primary language. So that's why for the past week we received more than 100 directly victims that were in the event. Some of them as a staff, majority of them as a staff, and they have been having nightmares. They don't feel like eating. They don't feel like sleeping. They feel very scared. They feel very vulnerable. and they have been sharing some of the stories that happened while those 9 to 11 minutes of intense panic, where like they observed people dying in front of them. They were trying to assist other people covering blood. A lot of these stories also make us think as human beings that it was such a big impact, and how was one person helping another person, a totally stranger helping another stranger, and how this also has helped us to become as more united in our community. At BBS, we're receiving these victims, and at the same time, we receive a lot of help from the community. We're accepting still donations. We're receiving food, clothes, other sort of resources for them, hygiene items, diapers for their babies. All these people that were there, they have families and they have needs. Some of them already are still very traumatized by what happened, and it's so hard for them to go back to their place of employment. So it's important for them to first heal everything that they're going through. What also happens in other situations is that when a person has a history of previous traumas and you go through another trauma, it's not just that, but it's also what else is in your own personal history that could be. So that's why some people are more traumatized than others, and some people say, well, I'm okay, I don't have any other of the symptoms, but at the same time the other person, it could be totally a moment of like enable them to work, enable them to function, enable them to be again socially function. So it's each person is under each different level that they're like overcoming these fears and these traumatic events. But at the same time, that's why also we believe on the power of group therapy, because as a group they provide a lot of support to each other, and having fellowship and companionship, that you're not alone, they were not the only ones there, and by them hearing other people's stories is also very healing for them.
And that gets to another common misperception, which is that Las Vegas is a major tourist destination, but where's the community? And it's been amazing to see the outpouring of support from the community, including right here at your office. But then that also gets to, as you were just saying, this is not going away immediately. Even if you don't see the physical scars anymore, there are still mental, emotional, spiritual issues, things that people will need some time, more time and some more assistance in processing. So what do you see as the long-term challenges, as well as ways people can continue to help?
Yes, we are going to need more help. We were talking that this is not going to be, mental health is very different than physical health. You go to the doctor, you get a prescription, you take the treatment, and then maybe that's it. With mental health, it doesn't work that way. It's more, again, each person has their own time of healing, their own process. So it's very important to understand that this is going to be a more like a long-term thing. Some people that maybe that hasn't even come here yet, they don't know they are having some symptoms that they might be being affected by. So it's very important that centers like here, like BBS and other centers in the community that are providing also mental health assistance, to understand that this is going to be not a one thing only, this is going to be like a long-term support. And that's why we need more resources, and that's why we need more donations. So for us to be able to continue providing, it's important to continue receiving the help from the community.